Good afternoon. My name's Ed Salsberg. I'm a senior research scientist at the George Washington University Fitzhugh Mullen Institute for Health Workforce Equity. I've been doing health workforce studies for over 30 years now, and one of the main tools, one of the important tools that I've used historically is a survey of new graduates, a survey of people completing training in the health professions, which provides an incredible amount of information, valuable information around the health workforce. Today, I'm going to talk to you about why and how and where we can use health workforce exit surveys to inform our work with the health workforce. First, the question of why an exit survey of new graduates. I think there are six main areas where I find this exit survey to be of value. First is it gathers valuable demographic and educational background information that reflects the future workforce. These are the people coming into the workforce. They will be the workforce of the future. Second, their experience in the marketplace reflects the current balance between supply and demand. Whether they can find a job or they can't find a job or their satisfaction with that really tells us a lot about the current balance between supply and demand in the workforce. The third area is that exit surveys can assess differences in experiences and practice patterns by sex, race, ethnicity, urban and rural backgrounds, educational pathways, educational debt, region of the country, and other dimensions of interest. So it can really give you a flavor of what's going on in a profession. Fourth, the survey can reach new entrants before they graduate and disperse widely. While the goal is to gather information on people entering the field, if you wait till after they graduate, they disperse widely across the state or across the nation, and it can be hard to find them, very hard to find them. So we take an approach of trying to identify and reach out to the students when they're completing their training before they leave the school. The fifth reason to use an exit survey is a tremendous potential to obtain baseline information on a cohort of graduates who you can resurvey in future years for longitudinal analyses. And it's really, I think that provides incredible value to the understanding the workforce. And then finally, doing an annual or biannual exit survey can reveal trends and changes over time. So the exit survey methodology, surveying individuals as they're in between completing their training, education, and entering the marketplace, entering the workforce, really provides valuable information for the health workforce community. Now, the question of who can you use the exit survey for or on to understand? Over the years, it's been used in a lot of different settings and different groups. In New York State, they use it to survey the physicians completing training in the state and across specialties. I've used it in a number of specific specialty-specific surveys of physicians who are completing training. And the third broad area, other individuals completing training in other occupations. We recently did surveys of people completing training in the field of social work. So it really can be used in a wide array of settings, different geographical units, and different occupations. In most of our surveys, we have 7 basic domains of questions. The first, the demographics. What is the age, the sex, the race, ethnicity of the individual who's completing the survey? We're also often interested in where they are from. Are they from an urban or rural area? Or perhaps their socioeconomic background. And so getting some basic demographic data on the graduates is really important to understanding whether those demographic characteristics are influencing practice patterns or their experience in the marketplace. The third area are the jobs that individuals are entering, including the location, the setting, the services they provide, as well as their income. There's always a lot of interest in what's the income of new graduates, what's the income by region, what's the income by setting, what's the income by gender. So we make sure we collect data on a variety of data elements around the jobs people are entering. The next are the experiences in the job market. We have a whole series of questions. Did you have a difficult time finding a position you were satisfied with? Did you have to change your plans? What's your perspective? Or do you think there are many jobs, or few jobs, no jobs within 50 miles of where you trained or nationally? So we asked them for their view of the job market. And that's really important to, again, for the labor market analysis of the particular occupation. The fifth area, the satisfaction with the job and income. The sixth is the population served. Are they serving high need populations, or are there particular subsets of the populations that they're serving? And then the final is their willingness to participate in future surveys. We asked that because we want to set up the possibility of doing surveys in the future. So we've been able in a number of surveys to maintain a database of individuals who completed a survey in the base year, but who said they were willing to participate in surveys in the future. The types of information that we're gathering, I mean, I've already alluded to some of this. We gain information on the job market, particularly important in whether it looks like there's a surplus or a shortage, because that goes to many policy options that would be of interest to the profession and to states and nationally. We also gather information on early career practice patterns. Where are people going at the beginning of their career? Clearly, if people are just coming out of their education and training, we can't say where they will end up in their career, but it does provide us with a good picture about where do people start their careers. We also include some questions regarding the view of the adequacy of preparation. Do the individuals feel that they, in fact, are well prepared for the jobs that they are taking? Now, we recognize that because people are just starting out in their careers, they may not be able to answer that. That's where a follow-up survey 1, 2, 3 years later would be probably better able to answer the question of the adequacy of preparation. But you can still get some valuable information by asking these questions. Fourth, we ask about satisfaction. I think that's really important. And along with satisfaction, we have a question about whether they would recommend the specialty or the field to others. This is particularly important in fields and occupations that want to continue to attract highly qualified individuals. The view of the education, the view of the field, the occupation, the specialty of graduates can be really important to encouraging others in the future to enter that field. And then finally, we gather information on those characteristics that I mentioned earlier and how they may impact on those practice patterns and on the job market and on satisfaction. So again, there's often a great deal of interest about whether there are different practice patterns, different incomes, different experiences by sex or age or race, ethnicity, or whether educational background impacts on the practice patterns, whether visa status or citizenship or geographic location impact. One area there's often a great deal of interest is whether there are differences by urban and rural areas. What's the experience, who goes into rural areas and what their experiences are. So this is the type of information that we gather. And then finally, the whole goal of doing the studies, the exit surveys, is to inform policy. So you think about what types of policies, what types of information are we gathering? So the first and one of the areas that we've tended to focus on is the job market, with the key question being, does there appear to be a current shortage or surplus? Are graduates finding jobs? Did they have to change their plans? How do salaries compare to others? How do rural and urban areas compare? Do males and females have different experiences in the job market? Do their incomes vary? This sort of information can really inform policymakers about the issues that are affecting the particular occupation or specialty. I think in terms of state and national government, the question of whether there is a shortage or surplus is really one of the most critical policy questions. If there is a shortage, it may be that there's a need for policies that stimulate educational programs to expand enrollment and capacity. If there's a surplus, then you don't want to introduce those sorts of programs. You may find through this methodology, you may find that there are some parts of the country that graduates are not going to, or the job market seems to be poor. We have found often that in many specialties and in many occupations, the real issue is not a shortage or surplus nationally, it's a maldistribution. By analysis of the data from your exit surveys, you can learn a good deal about whether there is a maldistribution of practitioners. And it can help, again, by understanding the dynamics within the profession, it can help you design at the policy level, design policies that respond to the real world of what graduates, the new supply, are experiencing. You gain valuable information about practice patterns. Do new practitioners locate in certain areas or setting? Are they the same by gender, by type of education? In several surveys, we've included questions, attitudinal questions about willingness to practice in rural or underserved communities. And again, understanding which practitioners in which situations are willing or more likely to practice in underserved area or rural community can inform policies. Satisfaction is an important area because if a profession or specialty is trying to encourage more people to enter the profession or specialty, it's really helpful to know what the graduates like and don't like about their new jobs, about the marketplace, about the salaries they're making. So again, the questions about satisfaction will really be helpful to the individual professions as well as the graduates. And then finally, the adequacy of preparation. Again, while I mentioned exit surveys are a little early in the professional work process, work timeline, getting some sense of whether your graduates are feeling comfortable and prepared for their new jobs is really valuable information to be fed back to the educational program as to whether, again, if you're in a field where the graduates are feeling they're not prepared, then that would be a clear call for some modification in the curriculum. So the exit survey really has many users and provides valuable information in a number of areas. I really urge you, if you're interested in considering an exit survey, feel free to contact me or feel free to contact the Technical Assistance Center at the Center for Health Workforce Studies at the University of Albany. Thank you very much.